Most people choose the gastric sleeve, but a lot of them don't fully understand what's required after the surgery. And that's where people can run into trouble. My name is Grace, and I'm a physician assistant who has worked with bariatric patients for nearly 20 years. In this video, I'm going to walk you through how the sleeve gastrectomy works, what it does well, and the long-term considerations you need to understand before choosing it. The sleeve gastrectomy, also called the vertical sleeve gastrectomy, or VSG, involves removing about 80% of the stomach, leaving behind a narrow, tube-shaped stomach that's about the size of a small banana. The gastric sleeve works through two major mechanisms. Mechanism number one, restriction. First, it restricts how much food the stomach can hold, meaning it restricts portion size when a patient eats. Let me show you what this looks like in real life. This is a soda can that has been cut in half and filled with solid food. Now, for most patients, this is the maximum amount of food they can eat once they reach the solid food stage of their postoperative diet. I wanted you to see this is normal because many patients are quite surprised at just how little they can eat at one time. Mechanism 2, hormonal and metabolic effects. It significantly affects hunger hormones. Many of the cells that produce ghrelin, a hormone involved in hunger, are located in the stomach that is mostly removed during the sleeve gastrectomy procedure. What this looks like in real life is patients notice that their appetite is greatly diminished. And after they eat, they feel full for a longer period of time. Unlike bypass procedures, the sleeve does not require rerouting of the intestine or malabsorption. The stomach is just reduced to a smaller size. And if you're comparing the sleeve to other procedures like the gastric bypass, make sure you watch my sleeve versus bypass comparison video, which is located down in the video description. Average weight loss with sleeve gastrectomy is strong. Many patients experience 20 to 30% total body weight loss, with the majority of the weight loss occurring in the first 6 months after the procedure. Weight typically begins to stabilize anywhere between 12 to 18 months. As with all bariatric procedures, outcomes vary and long-term success depends on follow-up and lifestyle support. The sleeve has a favorable safety profile, with an overall complication rate generally under 4 to 5%. Short-term risks include bleeding, infection, blood clots, and injury to surrounding structures. Other complications can include things like a stricture, which can occur when the stomach heals in a way that partially obstructs food from exiting the stomach. This is usually treatable with a quick outpatient procedure. The most serious complication is a leak anywhere along the staple line, but this only occurs in roughly 1 to 2% of cases. If this does occur, it usually requires an additional procedure or surgery. This is why surgeons take extensive precautions to reinforce the staple line during surgery. Okay, and this is where it gets real, because I'm about to discuss some things most people never even hear about until they're already preparing for bariatric surgery. Although the sleeve does not involve intestinal bypass, there are still some important long-term lifestyle considerations. First of all, smoking. Smoking must be discontinued at least 6 weeks before your surgery date. After that point, it continues to be strongly discouraged on a permanent basis after gastric sleeve surgery. This is because smoking can significantly increase the risk of gastric ulcer anywhere along the staple line. If this occurs, there can be pain, bleeding, infection, and of course this will require long-term medication, or if severe, revision surgery may be required. Next is NSAID medications, or non-steroidal anti-inflammatory medications, and are known by the common names such as ibuprofen, Advil, naproxen, Aleve, and aspirin. These medications should not be used within the first 3 months after gastric sleeve because the stomach is still healing at that point. Even after this milestone, these kinds of medications should be taken with caution. It is normally recommended to use the lowest effective dose for the shortest amount of time, and to take this medication with food and/or an acid-blocking medication. NSAIDs can increase the risk of gastric ulcers, and just in general, they tend to cause stomach upset. If pain management is needed, your medical team can find safer alternatives. Be sure to let providers know you've had gastric sleeve surgery whenever they're going to provide medications for you. One of the most significant issues after the gastric sleeve surgery is reflux, also known as GERD or gastroesophageal reflux disease. Some patients experience new or worsening reflux. This reflux may require long-term medication, or if severe, revision surgery may be required. This is one of the biggest reasons the sleeve may not be the right fit for everyone. Be sure to let your bariatric surgeon know if you have a history of acid reflux or GERD during your initial consultation. Carbonated beverages and air intake. Carbonated beverages, including sparkling water, should be limited. The bubbles can cause painful pressure, bloating, and excessive belching. Repeated regular intake of carbonated beverages can cause some stretching of the stomach, so this should be avoided. Also, overusing straws and chewing gum can cause an increase of air intake in the stomach. This can cause an increase in pressure and lead to abdominal discomfort. Some surgeons allow their patients to resume the intake of bubbly or carbonated drinks after about a year's time, but this is usually in small quantities and should be done infrequently. Be sure to discuss this with your bariatric surgeon if this is a concern for you. Alcohol absorption may be changed after the sleeve, and tolerance may be reduced. And remember, alcoholic drinks contain empty calories with no nutritional value. Also, excess intake of alcohol can lead to intoxication. This can lead to poor food choices and derail your health and weight loss. If this is an issue for you, be sure to discuss alcohol intake with your bariatric team. Although intestinal bypass and malabsorption do not occur with the sleeve, daily multivitamin supplementation and regular lab monitoring are still recommended for life after this procedure. Because deficiencies, although they are less common than with gastric bypass procedures, can occur. This is why it's so important to show for your bariatric follow-up visits. So any vitamin or mineral deficiencies can be addressed and corrected before they cause significant problems or health issues. Now, this next part is the most important. It's where I see patients either succeed or struggle. And this part is the long-term considerations. I know you've heard me mention more than once that the most important thing after a gastric sleeve surgery is regular follow-up with your bariatric team. Now, I'm going to talk about a few more reasons why this is so important. Dumping syndrome is rare with the gastric sleeve, but it can occur in some patients. Dumping syndrome occurs when high sugar or high fat foods pass quickly from the stomach into the intestine, causing symptoms like cramping, gas, diarrhea, sweating, or weakness. While uncomfortable, dumping syndrome will resolve on its own over time and can be managed with dietary adjustments. Nutritional deficiencies can occur after gastric sleeve. This is thought to be due to a decrease in stomach acid or just overall reduced dietary intake. Now, here are the vitamins you want to stay on top of. B vitamins, iron, calcium, and vitamin D. Another big one is protein. This can be a risk if not enough protein is consumed, leading to decreased muscle mass, weakness, and hair loss. So, for these reasons, lifelong vitamin and mineral supplementation with regular routine labs are recommended after gastric sleeve. Other possible long-term issues include gallstones that result from rapid weight loss, potential stomach narrowing or dilation, and new onset gastric reflux or worsening of pre-existing reflux. Patients may also face some issues with depression or anxiety as they adjust to their new body image and eating habits. None of these risks mean that sleeve is a bad option. It just means it's important to have a commitment to regular follow-up care. Gastric sleeve can be an excellent option for some patients. It is often recommended for BMI over 40. This BMI alone is usually enough to qualify people for surgery through their insurance company. BMI 35 to 39.9. BMI in this range will usually be able to obtain insurance coverage for the surgery if they have 1 to 2 coexisting comorbidities, which are illnesses known to be caused by overweight or obesity. A BMI of 30 to 34.9 is sometimes considered if coexisting illnesses are serious enough to warrant surgery. Also, patients who have made previous good faith attempts at weight loss but have not been able to reach their desired or healthy weight can qualify for surgery. Commitment. Candidates must be prepared to handle the changes that go along with surgery, including stopping smoking, reducing alcohol intake, and following dietary and lifestyle recommendations. Medical clearance. Patients must be able to obtain a physical and psychological clearance before the surgery. At the same time, gastric sleeve may not be ideal for everyone. It is typically not recommended for patients if you have any of the following: severe mental health issues, unhealthy coping skills such as using food to deal with stress, unable to commit to the changes required for surgery, any active substance abuse disorder, unrealistic expectations about the surgery, medical issues that prevent clearance, For women, plans to become pregnant or women who are currently breastfeeding. And as previously discussed, patients with pre-existing gastric reflux disease. Patients who struggle with follow-up or consistency might find these requirements too challenging or overwhelming. Make sure to discuss concerns with a bariatric surgeon who can give you personalized medical advice. Another important factor with the sleeve surgery is surgeon experience. Complication rates are generally lower when the surgeon has significant experience, often defined as over 500 completed cases. This is one of the reasons choosing an experienced ASMBS accredited bariatric surgeon is so important. ASMBS is the American Society of Metabolic and Bariatric Surgeons. Be sure to check the video description for a free printable PDF. Not only does it cover the top 3 questions you should ask a bariatric surgeon, but it also covers the gastric sleeve in detail. Gastric sleeve remains one of the most effective bariatric surgeries available. Now, this effectiveness comes with clear lifestyle requirements and long-term responsibilities. Understanding these realities before surgeries is one of the best ways to reduce regret, maximize weight loss, and protect your health long-term after your surgery. I hope you found this information helpful today. And if you're trying to decide between the sleeve, bypass, or other options, watch the video pinned in the video description box below. It'll help you compare them step by step. And be sure to subscribe. I release 3 videos a week that explain the professional weight loss world. I'm Grace, and this is Weigh In Wellness, where I provide safe, thoughtful, and fact-based information on surgical, endoscopic, and medical weight loss. And remember, this information is educational. I'm a physician assistant, but I'm not your PA. Decisions about treatment should always be made with your healthcare team. Thanks for watching, and I'll see you in the next video.